I'm David Mason, the Director of Public Health for the town of Sandwich, and we're doing public service announcement number 26. Today we're going to be talking about the types of testing programs that are out there, because there seems to be a lot of confusion, and with quarantining from different states or having a test before you come in or travel, we're going to explain what the tests are. We have Joanne Gake with us here today to talk about that, and Chief Burke also to talk about the testing program. But as we always do, we'll start with Chief Burke as far as our status in the town here with COVID cases.
Thanks, Dave. Good morning. Numbers as of today, 19th of August, one positive case. We have one serology case also that we're checking on, but the numbers are still good, and they have been all summer long. We've been seeing single digits. So please continue with what you are doing, mask wearing, social distancing, good hygiene, and so far so good. We've had a good summer.
Very good. So let's jump into the conversation about what's out there for testing, the types of testing, situations where testing is utilized. And the intent also is to, there's a lot of facilities doing it. We're not going to speak to each facility, but we want to make sure that you're getting the proper test that's necessary for the situation that you're in so that you're not paying for something that's not necessary. So we'll start with Joanne, and then we'll just kind of jump in as we go. Let's start us off as far as where we're at with testing or the types of tests that exist.
Okay. So first of all, the testing information changes weekly. So you'll be hearing what we know as of today, and the gold standard for tests is the PCR, and that's a diagnostic test. We have two diagnostic tests out there right now, the PCR and the antigen test.
So just to correct it as you're talking to the PCR is the nasal swab.
All right, so the PCR could either be the nasal swab, a throat swab, or saliva. And we
Very
can
good.
talk about that later.
Okay. Super.
Okay. So the PCR is the gold standard. If you need to come out of quarantine, you're coming back from travel, try to get a PCR test. And you can go online to mass.gov/COVID-19, and you can look at all the sites that are available. You also should call before you go to make sure that they'll do you as far as what kind of insurance you have and as far as time constraints. For the PCR, you'd like to have it back within 48 hours, because otherwise you have to be in isolation until you have the PCR back.
So depending upon where you have the PCR, and Chief Burke has done some work on this also, it varies where you go. So if you're looking for a timely test, you really need to ask the question, what's their turnaround time? Because what are we seeing on average, Chief?
So on average, 5 to 7 days, give or take. Those that have been to Whole Pharmacy in Hyannis on West Main Street, I've had a test there, 3 to 5 day minimum turnaround. And like Joanne said, if your turnaround time is greater than 3 to 4 days, it's almost useless at that point.
Right.
So that's why it's so critical that it's been all about testing from day one. We have said that as a group, and we've hoped that the federal and state partners would push this forward. We're still in a place where it's not solidified yet. So as Joanne said, it's all about turnaround time. Talk to your primary care provider and see what that looks like for turnaround time. But again, it's key to that 48-hour mark is critical.
Okay, very good. The as far as and when you're traveling, as far as quarantine, returning to the state from returning to Massachusetts from a naughty state or a red state, you're looking at needing a test within 72 hours of return. So you really have to judge and determine where you can get that test done.
Right.
In order to have it valid at this point. What else do you have, Joanne?
Right, to clarify for those people coming back, if you opt for an antigen test, and that tests for a protein on the cell surface, it won't do you any good. I mean, the antigen tests come back in like 4 hours sometimes 15 minutes. I'm not sure how expensive they are. I'm sure insurance pays for it, but it won't get you out of quarantine at all. In order to get out of quarantine, you need the PCR test.
Okay, so as far as, because there's also the antibody test, because we know that the antigen test, the antibody test is basically very similar, but the tests have a purpose also.
Right.
So, I mean, as far as those tests, we use them really as a strategy planning tool.
Correct, and I think that buzzword is assurance testing that you hear out there from the federal government and the state. Antibody testing is assurance testing to see where people are at. It can be used for surveillance. You can see how prevalent the virus was in your community. You'll hear terms of IgG and IgM antibodies. We'll make some sense of that later on. But IgG, if you show an IgG antibody on a rapid antibody test, it means you had the viral load 3 to 4 months ago, and you are past the virus stage and you have those antibodies. Now, there's studies out to say how long those last. You know, that's a whole different discussion. But again, the purpose that we have used it for is a screening tool. If somebody shows something other than negative on our antibody test for public employees that we've been testing, they go for a nasal PCR confirmation. And the nasal PCR is the gold standard right now for testing for COVID-19.
Because really, too, in terms of that planning, let's talk about getting the employees back, because it represents the population for the most part. As far as the antibody test was used as a screening tool to understand where we were at, and then just as you said, based on the result, you got the PCR. This is a cheaper way and a less invasive way to kind of get an idea of what we have going on.
And I think it's the other part that's important is you put eyes on each employee, which is critical, right? So they come in for their antibody test. Joanne will tell you also, the people, I know I had it in February. How many times have we heard that? They come in, their antibody test was negative. So you reaffirm with them at that time, mask wearing, social distancing, hand washing. There's not a get out of jail free card. You know, you still have to maintain the protocols. For town employees, that's important. They maintain their space. We've educated them early in May. We've been open since the 26th of May. Knock on wood, we have not had any issues yet. They've been following the protocols, and it's good peace of mind. A lot of us sit here and wonder, did or did we not have it? I had this cold, I had this illness back in March, April. At least the antibody test and the sensitivity of the one that we are using is extremely accurate. It's not 100%. It is in the high 90s. That's good. It gives people an idea of kind of where they are at this point with the virus and their potential exposure, and that they still have to be following the rules and be careful.
So I bring that up as far as, the employee program, because I think we're going to be seeing more of that on the Cape. You're aware of that situation, and as schools open, it's a tool to determine where we're at, and then to narrow down who we have to look at further, correct?
Yep. And I think the other thing you need to understand about the nasal PCR is you are that status at that time of the test, right? So you get swabbed at noon today, and it comes back negative. That means at noon today, you were negative. 2 hours from now, you could go to a beach party, you could go out, become exposed, and be positive. So you have to have testing, basically phases or setups where you can continually follow people as we go. And our plan with the town has been the antibody up front to get a prevalence screen basically where they're at. Those that need a nasal PCR, we push it forward and get them tested. I think it's important for everybody to understand we do agree nasal PCR is the way to go. Right. The issues are cost, supply, analysis. So if you take those three things out, what are you left with? Something is better than nothing. The antibody test is what we've looked at as an initial screen.
Wait, I have a new test that has just been approved by the FDA, and it's a saliva direct. It's a test that has been trialed by Yale School of Public Health. They're using it for the NBA. The NBA is in the bubble in Orlando, and it's working for them. This test is only a little bit of saliva from your mouth, not from the back of your throat or from your lungs, and they can get the result back in maybe 15 minutes. It should cost about $10. It costs $1.29 for the material to do the test. And Yale does not want any royalties from it. They just want to make this test available. And this would be our new nasal swab PCR type test.
So it would be less invasive
Yeah.
when it becomes available and easier to do at a cheaper cost also.
Well, it'll be available as soon as labs apply to Yale and are okay to do it.
Okay, because you've put in calls to inquire, correct?
Yes, I have a call in from yesterday to see where we are in the process. But, I mean, that would be ideal. And all you would have to do is think of your favorite food, get your mouth watering, spit in a sterile cup. It doesn't have to be anything special, and you have your sample.
Okay. So I guess then we can break it into two areas then as far as the testing needs, just to kind of summarize this. You know, we have our testing, types of tests that are used for, you know, looking at analytically where we're at in decision-making processes. And then we have the, and a PCR for, you know, confirmation. But then we have the, yeah, for diagnosis. And then we have the PCRs to meet the mandates by the state.
Right.
As far as what's necessary at this point, correct?
Yep.
So, I mean, so I think we're clear on that as far as,
Well, the state has finally, it's actually within the last 2 weeks, has said that the PCR finally is the test they'll accept for these various situations. It's the only test they'll accept, actually.
okay, all right. So you'll be hearing more as you go on, as far as the best, you know, there's a lot of information regarding the types of tests. Mass.gov has a lot of information also on that. And if there's any questions, you can call any of our departments as far as what's applicable to, you know, the type of test that's applicable if you're concerned also.
I just mentioned, Dave, where can you get a nasal PCR? So there's a couple spots. I mentioned Whole Pharmacy on West Main Street. You go on their website. It's doineedacovidtest.com, but it's a link directly off of their website. You can get into their scheduling. They're 3 to 5 days out, 3 to 5 days for a result, so be thinking of that. It's self-administered nasal swab under the coaching of their staff. So you have that. The CVS in East Falmouth, I believe, is a drive-up. Similar, also your primary care physician, and those are the 3 that I'm pretty much aware of right now for nasal PCR as we move forward.
Do you have any thoughts on that? There was another place in Falmouth.
There are 3 in Falmouth right now. The one in Hyannis were the ones you should be calling first to see what the time frame is in insurance. Some of them you don't need any insurance at all, like the Whole Health in Hyannis, but most of them you do.
Right.
But the goal right now is to get it done as fast as possible.
And there's a listing on the mass.gov under the COVID site relative to testing sites throughout the state.
Correct.
So there's numerous
Well, there's
facilities out there.
pop-ups, like a pop-up in Taunton, New Bedford right now. And you can go, and it's a drive-through, and get it done. But you do have to be on the website to see where the, you know, pop-ups are.
Very good.
The other thing I'll mention, Dave, is insurance. What I've been told, and it's based on your insurance, a lot of insurances will only cover 1 nasal PCR test, right? So keep that in mind. That's why Whole Pharmacy is such a good play in some of these other places where insurance is not required.
Yep.
You want to make sure you do your due diligence and with your insurance company to say how many will you cover, what's the residual cost. It should be free. That's just my opinion, where this has been from the beginning. But please be aware if you go through your primary care that I believe insurance only covers 1.
Okay, that's good to point out, and a good planning tool, especially, you know, for people who are traveling for whatever reason. And as far as the question regarding travel, what states are in and what states are out, mass.gov, again, has under their travel orders a map that identifies the states that you're allowed to travel from without testing, and those that require it. That changes regularly. You should check it daily depending upon what your travel needs are. Is there anything else we should cover for the people today?
No, I just let them know the PSAs are going to continue weekly. I know we took some time off, but we have a robust schedule for the next 4 or 5 weeks of guests and talking points, so we will be continuing every week.
Very good. Good point. We didn't want to oversaturate with too much information, and we want to provide the critical information that's necessary. So I guess we'll wrap that up today, and let's.
Can I bring up one more?
Sure.
If you have a PCR test done, because you don't feel well, you have symptoms, you have to isolate yourself until you know what's going on. You know, if you get a positive or negative PCR or you feel better, but you can't be out and about waiting for a PCR.
Joanne's watching. Be careful.
I am.
So so we'll wrap that up, and let's respect everybody's space, protect your own space, and be smart. We'll see you soon.